Hi, I'm JJ Hodshire, President and Chief Executive Officer for Hillsdale Hospital. I'm excited to share with you today some information regarding our annual review of all the happenings here at Hillsdale Hospital. We've been quite busy. It's been a remarkable year. It's been a year of journey. It's been a year of, at times, heartache, and at other times, celebration. And I want to bring to you today some of the elements that are contained within our annual review. The 5 areas that I want to highlight today are what are called our pillars. Now, our pillars are really the foundation of what builds our hospital. And those pillars are people, service, quality, finance, and growth. And I'm going to take you through a very brief journey of each of those pillars. Now, one of the most important pillars to me is our people. They really signify the work that we're doing here, and it's confirmation that we receive in awards and notifications from both the state and federal government that bears witness to the hard work that our staff engages in each and every day. And I'm excited first to share with you some milestones of our staff. We had a staff member that reached 55 years, and I'm going to start with the highest number 55 years of service, Doris Worley. Congratulations to your hard work. Other award recognition for this past year has been 35 years to Joni Westblade and to Lori Vogt. And then a 30-year celebration to Bonnie Schaefer and Leslie Harper. We're very excited to be able to say thank you to each of them for their service and dedication. It's the people that make a difference right here at Hillsdale. Institutions across this country boast about their wait times and the cost of their services. But one thing that we can really be proud of right here at Hillsdale is our people. They make a difference. The testimonials that I get and the comment cards are immeasurable. So to our staff that are listening today, thank you. For those of you who are not staff, but you know of these people, give them a thanks. A great job in Facebook, or even when you're in the hospital and you see them, just think a healthcare worker today, because they've contributed a significant amount of work to make sure that our hospital sustains into the future. We survey our staff frequently to determine their level of interest in the work that we're doing, and how are we as a hospital supporting them. And they have shared with those who are surveying the overwhelming support of the work that we're doing to support them. Inasmuch as I am pleased to report that the Gallup Exceptional Team Award was granted to the Environmental Services Department of our hospital, that we have been named a top workforce in 2023, and we have supported the advancement of our staff in many areas, millions of dollars that we've poured back into the education and training. And those can be in a variety of roles, taking an environmental service worker and allowing them to go in as a pharmacy tech. It could be promoting and advancing someone in their management degree and sponsoring their master's program, which we had several of those in 2024 that we supported. And the list goes on and on. New credentials, individuals becoming nursing assistants, RNs. And this is our way of giving back to the community, investing in our staff and investing in the community, that those who want to work here can have a pathway to a brighter future. And so for those staff members who have contributed to our people pillar, I say thank you. Another area of our pillar that is important to me is service. And when we look at service, we can look at them in a numerical state. So how many babies have we delivered? How many tests have we run? And I can give you those numbers. We've delivered 383 babies in 2024, and that number continues to climb, and we'll see additional babies being delivered here because of a closure of some obstetric units around us. We had over 7,500 home care services that we rendered through our home care department. We had 370,000 outpatient visits. Now, what that means is through our laboratory and through our radiology department, over 370,000 visits occurred. That's a lot of work for our staff. They're committed to working hard. In the same time period of 1 year, we had nearly 19,000 emergency department visits. And also during this time, we experienced 2,700 surgical procedures administered right here at Hillsdale Hospital. And so we have been able to, through the development of our hospital's programs, been able to give back sponsorships and programs totaling over $1 million in charity care, which was up 24% from the previous year in 2023. Our contribution is to constantly give back to this community, not only improving the quality of health, but also helping stimulate the economy and giving opportunities for individuals to be trained and educated. Now, all of those things are indicative because people use our services. So it contributes to our bottom line. It allows people to be employed here, allows us to give back to the community. But what is a driver of patient experience? And that's quality. And quality pillar is a very important pillar to me. And when we look at quality, we look at our outcomes. And our outcomes are incredible. When we look at some of our comparisons among other hospital systems, Hillsdale Hospital is batting right up there with the larger facilities and systems. And in fact, in some areas, even excelling and exceeding in those areas. When we also think about quality, that recognition that we get from national awards such as Best Nursing Homes in America, consecutive award that we have been given for the hard work that our skilled nursing team does, again, testifies to their work and their commitment to making sure that patients are well cared for and that are loved. The awards that we received for the Performance Leadership Award in 23 and 24, again, another testimony for our hard work. And so when we look at our CMS star rating, another opportunity within a 30-mile radius, Hillsdale Hospital is the only four-star skilled nursing facility. Throughout our system, we are making high quality improvements and receiving the recognition for making those improvements. Now, all of this, again, flows up to how well are we doing financially? And I can tell you that our economic impact in Hillsdale County is over $39 million. That's wages, benefits, that's what we give back to our staff in salary, that they then turn around and invest back into our local community. We also initiated during our fiscal year, in our calendar year, we issued what was called our Financial Viability Project. And it was really looking at a pathway for improving our financial standing as hospitals across the country were closing. Hillsdale Hospital was remaining strong. In fact, since 2010, over 150 hospitals have closed. And in order for us not to make that list, we have to do well financially, and we've done that. But if you want additional information about how well we are financially and about our financial health and performance, you can go on hillsdalehospital.com website and learn more. Another important pillar for our hospital is our growth pillar. What does that growth look like? Well, I can tell you that we have grown in specialty areas where I was once told by my colleagues and individuals across the state and country that we would never service in areas of neurosurgery and vascular surgery. And guess what? We have challenged that notion and we have excelled. In neurosurgery, we have a neurosurgeon who is operating exclusively right here at Hillsdale Hospital, nowhere else. 100% of the services being rendered in our community. That's incredible. In vascular surgery, the work that we're doing there, bringing surgeries here that would have never been done before, is keeping our patients right here in our local community. So you don't have to travel. The partnership of Dr. Loganathan, Dr. Alam, and others for making this possible. We can't forget the launch of our $1 million campaign. It's been a lot of hard work by Kirsten Newland, who has worked very aggressively to raise those dollars. And we're going to be coming out with an announcement in the very near future to talk about how well we've done. But bottom line, this community stepped up. And while we're providing resources as a non-for-profit to other non-for-profits, our community in 2024 said we want to help Hillsdale Hospital as a non-for-profit. And we had our biggest representation at the Great Give. We've received significant contributions in all different denominations, anywhere from $5 to $25 to a family that's given nearly six figures. So we are very grateful for the commitment that this community has made because we can invest those dollars in much needed technology, equipment, and programs. Folks, this has been a remarkable year, an opportunity for us to really celebrate the great successes in our community. And I want to share just these few highlights of what we have done, but more comprehensive can be found at hillsdalehospital.com report. And as we begin to focus on 2025, I want to thank you, our community, for your contributions, for using our services. You have supported us in an area where we thought would never be possible to raise 1 million, to look at services that we've never brought here and to use those services and continue those services. This year, I'll be introducing some new and exciting things. I'm excited to offer podiatry for our first time. I'm excited to offer some new telehealth products that are going to be very important to the continuum of care for you and your family, to keep those services right here. And so I would encourage you to engage with us. We have opportunities every week in which we're coming to you, the community, on our live events as well as radio programs, our podcast, and we're going to be launching some new things that are going to be very exciting for me. So I would encourage you to stay engaged with us. Go to our Facebook, go to our website, plenty of opportunities to actually work with us. If you're interested in joining a winning team, an opportunity to serve right here in this community, for us to invest in you. Maybe you want to pursue your education and you're looking for a pathway, it can happen right here. Maybe you have a son or a daughter that's going to be graduating this year. There's an opportunity for them to become a registered nurse, paid for by Hillsdale Hospital. This is our way of giving back, but in 2025, we have a great opportunity ahead of us. So until we see you again, stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first.